Biomedical waste management. Biomedical waste management is an important aspect in the healthcare industry. We'll see about what is biomedical waste management, how the waste are being classified, what are all the risks if we are improperly managing the biomedical waste management, what is the correct and right way. This one mainly, if you see biomedical waste management is not managed properly, it will be the high risk for the spread of infection. Also, the healthcare cost will be the very much high. That is the reason we are segregating the biomedical waste in a right manner. So how we can classify the waste? The waste can be classified as a general waste, which is coming domestic waste, fruits and paper, etc. Pathological waste is nearly tissues, organs, body parts, human fetus, blood, fluids, body fluid, etc. Infectious waste is a culture from the lab, and the surgical waste, autopsy of the patient, hemodialysis and infected animal waste. Sharps or the needle, broken glasses, syringes and glass pieces. Pharmaceutical waste is the drugs, spilled medicines, expired medicines and chemical. You might have heard this pharmacological waste has been improperly put in the over the streets for 10 years back, and some of the mafia people has taken and misused. One child died. After investigating, they have made a strict rules and regulations for putting the proper expired medications. They have changed all the numbers and codes, batch numbers, and they done a resale activity. It's very dangerous. And radioactive waste, solids, gases, liquids, waste containing some of the radioactive substances. Chemical waste or the reagents from the lab and expired disinfectant. And the genotoxic waste or the cancer treatment waste and the chemicals that causes the genetic mutants. Metal waste or the batteries, thermometers, blood pressure measuring devices. Most of the hospitals has been changed to the mercury free thermometer, but still any hospital using that to generate the waste. Pressurized containers and aerosol, gas cylinders, cans, aerosols, high pressure waste. So this is the waste. How will you manage? Actually, the biomedical waste definition is the waste which is anything which is generated during the diagnostic, treatment, immunization of the human beings or animals, or the research activities that is testing the biological components. All these waste are called the biomedical waste. What is the risk for the biomedical waste management? There is an increased risk for infection. If you are not discarding it properly, it may prick the people who are taking the garbages, and increased risk for the hepatitis B and HIV/AIDS also it is also poisoning. What is the risk? The hospital infections will be spread to the staff. I told you already, where they are handling this one, it will be then if they improperly discard it, also the scavengers will be, rackpackers will be picking up the used syringes. They may recycle and they may reuse again, not recycle. They don't recycle it. They may wash it and prick them, the drug addicts and other people, and then so the general public also been affected. This is how the infection has been transferred. The injury to the job, any accidentally needle stick injury, some people will be hiding it. So you have to make a immediately incident report and inform and take a action. Negligence. Okay, I have done a hand wash. Why I have to do? Ignorance. Oh, that patient is not having HIV/AIDS. So what I will do? No problem. Drug addicts or exchanging the same syringes, because as I told you. So this is how the mode of transmission from the biomedical waste from this one, transmitting from the one to another one. So how will you manage the biomedical waste management? It is the process of collection, treating, recycling, disposing of the different waste materials. So this is the process. What is this? If you see the biomedical waste management, there are the 5 major steps: segregation, disinfection, storage, transportation and final disposal. Any of these 5 stages are missing, anywhere the infection can be transmitted. What's called segregation? Segregation is the where it is done. It is done in a ICU, stores, pharmacy, lab. Everywhere you might have seen the color code dustbins and papers bags might be kept it. Main purpose is avoid the making the infectious waste to reduce the cost and to reduce the infection. Why reduce the cost? Because there are some voluntary agencies or the non-governmental agencies are coming forward to take this waste, because it's not like a water treatment that you can treat and reuse within the hospital or in the industry. So these people, for per kg they will charge maybe 10 rupees or 20 rupees per kg of this infectious waste or biomedical waste has been put a charge. So it is very, if you dump the general waste into the biomedical waste also, the cost is going to be increased. That is the main purpose also, the segregation, other than the infections. Also the recycling purpose. How do we segregate? That's called the color coding. Yellow color, human animal waste, tissues, body parts, dissected body part, aborted fetus and specimens. Red color will be the laboratory waste, culture plates, gloves and tubing and catheter. Blue and white will be needles, syringes, scalps, blades and broken glasses. Green will be the office stationery, tissue paper, kitchen waste, disposable papers, cups and water bottles. Black color will be cytotoxic waste, expiry drugs and medicine, radioactive substances, radioactive waste and pesticide and insecticide waste. So this is how the color coding has been done in each section of the hospital, either in ICU or in the operation theatre until to the OPD. Any small procedures also they are coming. What is next? Next is called the disinfection. What is the disinfectant? Thermal, chemical, radiation. Use of the microwaves. Thermal will be the dry and wet autoclaving will be used. So most of this disinfection, sometimes in the OPD itself they will clean and send it for the autoclaving. So they will do it. And chemical will be formaldehyde, ethylene oxide, bleaching powder has been used. Irradiation by the UV rays, and also use of the microwaves and the grinding systems of spraying microwave radiation that been used it. Next is the storage. So where it should be stored until it adequate quantity accumulates, stored until the camera for the specific place. So why it should be stored in a camera or the specific places? You might have heard that some hospital they have stolen the placenta of the fetus. Some people are stealing, and sometimes rats and dogs may be pick and take it to the roadside. So these all camera under that you have to store. Why we have to store? Because it's a cost. So every time you cannot call the people to take the waste. So some accumulated some quantity has to be stored. Then only the transportation will be coming. What is called transportation? Transportation is the place where they are taking this biomedical waste. There is a two transportation: internal transportation, internal transportation. Trolley has been used, and the person will be wearing gloves, mask, and the hand gloves. Everything he will be collecting it from the ICU wards and OPD, and he will store in one particular place, right? Then will be this collected item is stored. Once it is adequate quantity has come, the hospital authorities will be calling for the external department or who is doing this, where it will be biomedical waste, it will be away from the city. So what they are doing, the incineration, some things and all, they are doing, soil pollution may occur. So it should be away from the people who are living. So it will be, might be from the 30 or 40 or 60 kilometer, which is away. If you see in Chennai near Sengalpattu, after the Sengalpattu, there was some places where it is approved. Pollution Control Board, everybody has to give approval to dispose this waste. So those people will be coming and collecting it. So external, they will come by the lorry. So they will be hospital dumping place. They will be coming and taking it to the disposal. So what do? They do the final disposal. So what they do mainly, this industry we have visited. So these one they will be dumping. People will be coming again. They will be segregating. They will collect. How they segregate, like yellow bag and other thing. What have to be incinerated, they will be segregated. And landfill and vermiculture landfill, and we were asking questions. So these employees, what is the protection? So the nearby villages are coming and helping in the incineration, burial, all these processes. So they have to get the adequate vaccination. So this is how biomedical waste and the biomedical waste management. In this one, you have to see the important measures. The biomedical waste management measures, everything we are doing, the main thing is attitude of the employees. So attitude is very much important. For that, what you have to do, this attitudinal change of all the doctors and nurses, you have to segregate. Every time you have to celebrate or you have to do some biomedical waste management day or infection control day. You have to motivate them, create some dance and activities and encourage them, and training and motivation is very much essential. Responsibility, the individual and hospital responsibility should have a good communication, that how it is important, why it is important, and occupational and pricing, like how as I told you earlier, that the cost reduction process. So if you segregate properly, your cost will be reduced. And surveillance, who will do that? The surveillance and monitor entire process will be done by the infection control nurse. How many people are getting the needle stick injury? How many developed the HIV positive, or someone developed the hepatitis B positive? And then monitor the accidents. How many needle sticks injury are happening? Control the rag buckers, and the public education and awareness screening by the infection control committee. So one of the students also got this infection and then immediately she reported. The same way the other student did not do that, and she developed the hepatitis B positive. Until her age, now 32, she not get married. So small ignorance of the faculty. Then other people, how he treated, they have immediately treated. The patient was positive, 30 days they have taken antiviral therapy or something doctor has prescribed that time. Maybe now I don't know what is the protocol, that may be changed, maybe less days with the good medications can be changed. And plastic waste, why I told, in the biomedical waste, if you take it, nearly the 50 to 60% plastic waste also there. So in the plastic also, most recommended one is called the reuse. That reduce, first you have to reduce, most recommended one. So you have to reduce, reuse, recycle, recover and landfill. The landfill is the least forward, because it takes 1 gram or 1 kg or some of the plastic, it will take nearly complete disposal. Decomposition takes 200 to 300 years. So this is the one, reduce, lowering almost lowering amount of the waste products. So you will reduce it, and then reuse it. Reuse material repeatedly. You can do autoclave and then recycle it. You can break it and make it, like some people are the plastics roads they are making, and then recovery, the generate the energy from the waste. The Swachh Bharat and all, they are motivating this one, right? Then the next one is called the landfilling, safe disposal of the waste for the landfill. They put it in a thick of the black color, this one, and they put it so that it will not enter into the this one. It may affect the soil pollution, and this soil cannot be used for any cultivation. So this is how the biomedical waste management is very important chapter. Though you should write about the definition and the classification of waste, and definition and importance, risk, and then how you will be managed waste management under the heading of 5 categories. And overall these things, anything that attitudinal change and the training is important for the people to do the correct management of in the hospital or industry, healthcare industry. Thank you.